Oh, yes.
Okay, so
All right.
I'm the first one. Yeah. Okay. Okay. Good evening, everyone. I'm Dr. Ben Liang from Taiwan. Thank you for being here. I am going to talk about the comparison of cone thread, unidirectional and bidirectional cone thread for eyebrow lifting.
Hey, Ben, excuse me.
Yes.
Yeah. Let me introduce you in the beginning.
Okay. Okay. Thank you.
Yeah, I know. Ben actually is a rising star in not only in Taiwan but also in China, and he has very good experience in handling patient, treating with threading, and we say he's the prince of the threading in Taiwan and China, right? Is that correct?
Thank you.
Okay, so let's welcome Dr. Liang from Taiwan to give this talk.
First of all, I would like to give our audience today, which is pretty up close and personal. We have not so many attendees, but anyhow, today
I always think about these three components: patient and thread layer selection. And today I focus on the layer selection. I think anchor point and target tissue is very important. So I usually make the anchor point to hard tissue, for example, zygomatic ligament or musculoskeletal ligament. And the target tissue should be jaw fat, usually superficial fat. So I usually using this type of thread lift pattern. I put the insert point above the zygomatic arch level, and the cross line of the zygomatic arch and the hairline, and I insert the bidirectional core to the jaw and nasolabial fat area. So I believe that retained ligament are very good and strong anchor point.
Perfectly.
Yeah, good.
Okay, great. Hi, I'm Dr. Gordon Koo from Melbourne, Australia. It's a pleasure to be sharing this discussion with you. The topic of my talk is on 3D anatomy for safer and more effective thread lifting of the mid and lower face. This is my disclaimer. And a quick overview of my talk. For safer and more effective thread lifting, the key anatomical considerations are the 3D anatomical planes, the superficial fat compartments, and the anatomical layers. So let's first look at the 3D anatomical planes. We already know that with aging, the superficial fat and skin would sag over time, but this sagging is not just downwards in one plane. The sagging is inferiorly, but also anterior and medially. So it's a three-dimensional multi-plane process. If you take a look at this anatomy of the planes, we have frontal plane, transverse plane, and parasagittal planes. So the aging sagging involves all these planes. So this means with single threads pattern that we know of, for example, some textbook illustrates the thread lifting pattern just in the lateral face from the jawline to the temple. This is only addressing the parasagittal plane. So if you only place threads from jawline to temple, it won't be as effective because you are only addressing one plane of the face. So the thread